Hey, what's up, guys? It's Megath here. So, today I want to talk about obviously updates about my physical therapy, as well as occupational therapy. I also want to go over a little bit about misdiagnoses and doctors refusing to diagnose, even when like symptoms are obviously there, and other diseases or such with it. Um, Gonna talk a little bit about Sjogren's. It kind of plays into the miss or refusing diagnosis type stuff, and about the symptoms with it. Um, so first off, we'll just start with the updates. PT is going really well still. I have two more appointments left, and then I'm good. The therapist last week said that if by the end of the last appointment and I feel good, I'm not hurting like I was, I'm not in all that pain type of stuff, then I should be good to go, and I shouldn't need to request more. So that's nice. And yeah, so another funny, actually a funny little thing with the therapist is uh, last week when I talked to him, I told him, my upper back still hurts a little bit, and which I'll just address that with um, my pain specialist and see if they can do some sort of shot or burn or something with that. And but what was funny is, he asked how I was feeling, how my back was doing, and just how my day to day was, now that I'm this far along in my process. And I told him, I said I am feeling a lot better and more back to normal. And I corrected myself and said, well, more back to my normal, that is. And he chuckled for a second, and then he said, that's good. I don't like your normal, but that's good. So it made me laugh a little bit, that he said that, which is true. I mean, yeah, my normal sucks, but it's my normal, and that's what it is. And as long as I can live with that normal, hey, I'm good with that. Um, as far as the hand therapist, that starts Monday. And I said before, it's a occupational therapy specialist. I guess I don't know the exact difference. Obviously, she's got more tools and training and whatnot. So I'm curious to see how that goes. I even have this that a buddy of mine told me to get, and I've used it a couple of times. I'm not sure how well you can see that, but it's called the NSD spinner. Best I can describe it is kind of like a gyroscope, and you kind of like you wind it up, and then you kind of do this type of motion, and it doesn't just work your hand, but it works like the whole forearm. Like 10, maybe 15, 20 seconds at best. I can do that without just that intense, like exhaustion feeling in the muscles. But I'm gonna bring that with me when I go to see if that's something I should be doing even be doing right now, or wait till I'm at a later stage or whatnot. But I like it in general. It's really cool. It really does a good job, working that. Probably better than any other hand tool or device I've used in the past. So if you just want it just to strengthen your hand and your forearm, give it a go. I mean, it's not that expensive. I think it was like $20 maybe on Amazon. I don't know. I'll find the link for it and send it in my video down below. So there's that. And then on Thursday, I finally, after a lot of calling back and forth between my pain specialist and the doctor's office, I finally got an appointment, and it's with not just a hand specialist, but it's actually a hand surgeon. And thankfully, it's more local. It's just like 20 minutes away. I was originally planning it to be in Los Angeles, which is a good couple of hours away, and that's brutal on me driving that long, and that's just one way. So I'd basically be doing like 4 hours at least of driving, and that would have been really tough on my joints. And so I'm grateful that they were able to find one locally that is willing to take my county insurance essentially. So I'm excited about it, but Sorry. But I'm also worried at the same time just because, it's a hand surgeon. Now, that doesn't necessarily mean I'm going to have surgery, but it kind of makes me wonder if that's a thing that might have to happen given the state of degradation in my left hand, and the constant pain and whatnot. So yeah, I just hope it's not because one, I have autoimmune disorder, disease, whatever you want to call it. I have autoimmune. I have my Ehlers-Danlos, which isn't an autoimmune, but it's still, I say it's up there personally. Like if anyone comes in my house with just a cold, and I'm not even in the same room with them that much, I still get sick, like really easily. And so just between those alone, but also because I bleed really easily, and surgery is always a risk with my Ehlers. Um, and so plus all the medications I'm on, and yeah, it's a risk, and it's also getting surgery is a pain, extra pain for me, and in particular, I don't know if it's for anyone who deals with a pain specialist, but my pain specialist refuses to allow anyone who gives me prescription painkillers, even if it's Tylenol or ibuprofen, right? I've already gotten in trouble for just that. Like I went to the dentist and they gave me some prescription pain pills without me knowing it, and they chewed my head off. And so, with in terms of getting surgery, I have to let them know ahead of time. Hey, you can need to get these painkillers cleared with them before I can even do this because I don't want it to get dropped from them. And then there goes all my pain pills, my nerve burns and shots and everything else they do for me, and that would just be devastating. So yeah, that's another just problem off to the side type problem. But yeah, between those three things, I'm always leery of any sort of procedure or major surgery, which this would be. I'm assuming they would just correct the carpal tunnel, but who knows? Maybe they'll go in and clean up all the plaque that's been built up in this joint as well. I don't know. I think that's what they said it was, plaque, or I don't know. I can't remember. But yeah, so there's that. So excited, nervous at the same time. So those are my updates. So now I want to get into misdiagnosis and refusing to diagnose. Obviously, I've been misdiagnosed many times, mostly because I didn't even know what Ehlers-Danlos was, or it was even a thing until I got diagnosed with it. And and I know a lot of the doctors I've seen, at least in the first 2 years, didn't even know what it was. And nowadays, it's probably like 3 years later, I'm actually seeing more and more doctors versed and therapists versed in it, or at least have an understanding of what it is. So that's good. But yeah, initially, it was really tough because like, oh, maybe you have Marfan's, which I've been told most of my life I had Marfan's, which I had a genetic testing done through a heart specialist who said that the test came back negative for it. So, it's easy to get misdiagnosed, especially with something like Ehlers, but just in general, a lot of people probably deal with it. I know I've dealt with it on some things, and it can suck because if you get misdiagnosed and the treatment doesn't help, or whatever, you're just not going to get better until you have that right diagnosis. On the other side of that is you're a doctor refusing to diagnose you. About, oh gosh, like 8 months ago, I want to say 8-10 months ago, I've been seeing this eye specialist doctor for a couple of years now, and she's mostly just been doing giving me prescription eye drops like Restasis, and putting these eye plugs into the tear ducts so that it helps the tears collect in it and keep my eyes moisturized because I had dry eyes. And eventually she did some really extensive testing on it and found out I had a condition called MGD. Don't remember exactly what it stands for, but I'll make sure to provide a link to just at least what it is in the video down below, so you guys can check that out. It's not like, I wouldn't say it's super bad, but it can definitely, if untreated and if it's really bad like mine is, it can lead to loss of vision or vision impairment. Essentially what happens is, like, you get this plaque buildup. You have these little rows of oil on the bottom, on the inside here, and on your eyelids underneath. And every time you blink, that oil secretes over your eyeballs, and it keeps it, moist, and locks the moisture in. And so with me, they're supposed to be, perfect straight rows. Well, mine was either cut off or missing or jagged or just all kinds of crazy ways. And so obviously every time I blinked, it didn't really get that. Plus they were also, I think she equated it to like syrup, like that's supposed to be more like oil, but like actual oil. But mine was more of the consistency of like syrup or honey or something, is how I think she described it. So every time I blinked, normally it didn't do anything. I had to like squeeze my eyes together to get something out, and it got really bad. Basically, every time liquid or like tears would hit my eyeballs, it would just immediately disintegrate in the air or evaporate, because there's just nothing there to help it stay. And it's just it's just causing my eyes to be even more dry than they already were, and just affecting my vision and all kinds of nasty stuff. And eventually I had to pay out of pocket to get this procedure done, which I have to admit I was really skeptical. I mean, it was like $800, and insurance wouldn't cover this type of procedure, and I was like, I get really skeptical, because you never know. You want to trust your doctors, but you just don't know, right? But I had it done. Basically what they do, they take it almost looks like a power toothbrush, but it's got this like almost like a cotton head looking thing on it, and they just like basically scrub out every single oil gland, top and bottom of both eyes. And then they put these suction cup type things on you that heat up and twist, and just get off every little bit on your eyes or anywhere else all that nasty bad bacteria has built up. I will say it was a very unnerving experience. I don't think I'll ever want to do it again. But I will say, after 6 months of having that done and just making sure I use my the foam scrub for my eyes every day, and the 2 different types of eye drops every day, twice a day, they're better. That stuff is almost all gone. They said there's only like a 2% amount of it there, and that my eyes are looking really good, really lubricated and whatnot. And so now we just get plugs back in to help out with even more moisture, and just keep it up, and just regular checks. So that's good. But more to my point, the thing is that she, with all this going on with my eyes, and me telling her about my Ayler's background and all these other problems I'm having, and how I have like severe dry mouth and severe dry skin problems, and all these other health issues I have, and see if that would help her in figuring out why I'm even having this. Not that it's not that uncommon for someone to have MGD, but to the degree I had it, she said she has never seen anyone in all her years as an eye doctor have it as bad as I did, which is not pleasant. But hey, I am top achiever. No, I'm just kidding. Sorry, my dark humor there. But anyways, so I gave her all the info, and then when I saw her again at a later appointment, she came and told me, he says, talking with other doctors and researching all this stuff, she says, I feel you have Sjogren's disease. And I've heard of it before. I've actually had it brought up many times from my pain specialist and my rheumatologist. They both had a thought that maybe I had Sjogren's. But there is a test that you can do that shows if you have it or not, but it's not like bulletproof, okay? Because you have to have, it's like with like rheumatoid arthritis and stuff, it has to be active. It has to honestly be active when they test it. If it's dormant, it won't show, right? So you could be, oh, you have it this time, but next time you don't have it, right? And so it's hard to actually diagnose based on blood test, right? And so that's when you really need to start looking at the symptoms. And I have all of them. I have really bad teeth, right? I'm sadly to admit I'm missing a lot of teeth. Okay, and that's not just from Sjogren's, but it's also from Ehlers. So it's kind of double whammy. And then I have really bad dry eyes, like I was talking about. I have severe dry mouth. I'm having it even as I'm talking, and I get it even worse and worse as I talk. That's why I often have to take a sip, like right now. Um, and just all these other symptoms that are along with it. Plus, last year I was diagnosed with neuropathy. And if you look up neuropathy, it tells you that if you have this, you're likely to develop something like Sjogren's. Or that's often where Sjogren's comes from, is something like that. So I have all this stuff that, like, almost every single symptom I have, or at least a majority of them. And, my pain specialist, like, talked to them about it, and they're like, oh, okay, but they didn't really care to do anything, give me any medication to try it, because it's not like the medication is going to be like, oh, if it's wrong, oh, that's going to be detrimental, right? It's not. Okay? So it doesn't hurt on certain medications to just test if you have all those symptoms, right? But they didn't want to do anything. So I brought it up to my rheumatologist, and she said, oh, your eye doctor said that? Well, I don't think you have it because of past tests, and honestly, she's an eye doctor. She's not qualified to make that call. And I was just like, yikes. I mean, I love my rheumatologist. She's really sweet and everything. And she does a really good job at helping me get the right doctors and pushes for me and advocates and all that. But, I mean, every doctor has something that you don't like usually. I mean, some doctors you absolutely love, and that's great. And for the most part, I like her, and I want to stick with her. I mean, she's the one who helped fight for me to get the Ehlers actual diagnosis, and even tried to push for me to get a geneticist. Unfortunately, they all turned me away because of Ehlers, but that's another story for another time. So it's just frustrating because I'm almost positive I have it. All the symptoms are there. All the issues with it, and just the autoimmune disease and just all that, and so it's frustrating not being able to get it, not even having them like willing to be like, oh, okay, let's at least try the medication, and if it helps you, it helps you, and if it doesn't, it doesn't. Then maybe you don't have it, or maybe it's dormant, or I don't know how all that really works still. Either if it's dormant, does it help you? I mean, I assume so. It does with rheumatoid arthritis. So I have to believe it works the same way, but it's just frustrating when you can't get, doctors to listen to you when there's nothing more you can tell them except for, hey, look, I've got A, B, C, D, and E of, of the 10 symptoms or 8 symptoms or whatever it is, but because the test that can not be accurate all the time says no, hey, I mean, she was at least willing to do another blood test, which I haven't gone and done because I just haven't had the need to go in general. And I could just go for that, but I mean, I kind of feel like, what's the point? My luck is it's not going to be active again, and it's just going to come back negative, and it's just going to more affirm her ground on me not having it. So, probably whenever I get another physical with my doctor, which probably should be this year, my general doctor, I'll probably just do it then if it's still in the system. But anyways, it's just kind of frustrating, and so I feel for all you who fight for getting a diagnosis, no matter how small the disease might be or how little it impacts your life. It's always good to have those diagnoses. because it just helps, validate things you feel, or just that validation of knowing that you're not going crazy, it's not all in your head, all those kinds of things. And so, don't ever stop pushing for it. I know I'm not going to, I might let it lay low for a little bit if need be, but I definitely am going to, keep it up. And, I just tell any new doctors or current doctors that don't really deal with my rheumatologist that I have it. I'm just going to flat out say, I have Sjogren's. And just kind of take it from there, and maybe, hey, one of the times, one of the doctors was like, you're not on anything for that, here, let me help you out, and who knows. But that's just the way I look at it right now, and it is what it is. Like I said, I'll keep advocating for it whenever I see opportunity to do so, and try to get something for it down the road. So yeah, don't ever stop fighting, okay? Don't ever stop advocating, no matter how disappointing or depressing it could be. And I think with that, we're going to end this video. I am so grateful for all of you and those who watch. Please like and subscribe to this channel and my videos. Hit like on any of them that you like. Please drop me any comments you have regarding my health conditions, things you want me to talk about regarding them, or any questions you have about them, or things you'd like me to cover more in depth. And again, like I always want to say each video, you guys have worth, you guys have value, disabled or not, you are who you are for a reason. You have what you have or don't have for a reason. This world is better off with you in it. We definitely, the world would definitely be worse off without you. I just want to say I love you all, and keep fighting and keep advocating for yourself. And if you know anyone else that's like that, advocate for them too if they can't. And just be strong and hang in there. So thank you, and I'll see you guys next time.